Okay, thank you everyone for tuning in. On behalf of Manila House, this is Bambina Olivares, Director of Programming, welcoming members and non-members alike to today's online conversation, How to Avoid Burnout, presented in partnership with Luminisce Holistic Skin Innovations. The last 18 months have felt like 10 years. It's been a long pandemic for everyone, and it's absolutely normal to feel anxious, worried, and stressed, what with the constant lockdowns and emerging variants. Even with our work from home situation, we still end up feeling burnt out. As we know, however, keeping our immune system strong is part of our defense against COVID. Yet stress can and does adversely affect our immune system. So, how do we stay healthy, stress free, and avoid burnout in the process? Allow me to introduce Dr. Kaycee Reyes, the powerhouse doctor behind Luminisce Skin Innovations. Give me a second there. So, Dr. Kaycee Reyes is a wellness expert, health advocate, and preventive medicine specialist who also happens to be a member of Manila House, I must say. She's a wellness expert and health advocate. Dr. Kaycee Cuevas Reyes studied medicine at the University of Santo Tomas, Faculty of Medicine and Surgery. She completed her diploma in dermatology from King's College with a Master in Science in Clinical Dermatology from St. John's Institute of Dermatology at Guy's and St. Thomas Hospital in London. She also has a Master of Science in Preventive and Regenerative Medicine from Dresden International University in Germany. Her degree in preventive medicine also makes her one of the few physicians to have an internationally accredited degree in clinical medicine specializing in well aging and regenerative medicine. As an advocate towards health and wellness issues in the Philippines, she formerly directed the Alaga Ka Project, a local cause that focuses on helping underprivileged communities to renovate their barangay health centers and includes staff training. It has become her mission to educate, inspire, and help people to live happier and healthier lives through encouraging important lifestyle changes. I'd just like to take this opportunity before we begin to remind everyone to stay until the very end to win some wonderful giveaways to help you de-stress, courtesy of Luminisce. We have over seven, actually over nine gifts to give away, which include special treatments worth up to 24,000 pesos. We also hope you're enjoying your beautiful snack boxes, again, courtesy of Luminisce. And before we begin, just a few ground rules. This webinar is being recorded and will be up on the Manila House YouTube channel in a day or two. It is also being live streamed on the Manila House Facebook page, facebook.com// Manila House Inc. Please use the chat box and the Q&A box for any questions and comments, and we'll get to your questions as we go along. Also, I'd like to remind everyone, our members especially, that Manila House is now open for dining on a limited basis according to LGU and IATF regulations. So that is a certain percentage allowed outdoors and indoors. Kindly bring proof of vaccination, either your QR code or a screenshot or your physical card if you have when you come to the club. And also, I'd like to remind the public at large that our takeaway service is still available and open to everyone. And please give us a call on 0917-816-3685 to place your orders. Now, let me turn you over to Dr. Kaycee Reyes, who will talk to us about avoiding burnout and keeping as stress-free as possible. Doctora?
Hello. Hi, good afternoon. So I'm going to share my screen. So actually I'm going to talk about burnout and what are the treatments for burnout. So what is burnout? Actually, burnout stems from stress. All of us now are experiencing heightened stress, which can actually cause or trigger anxiety, depression, and burnout. But what are the common things that that causes those things. Actually, it's stress. So I need to explain to you what causes stress and what is stress. So here you can see stress-associated diseases, which is one of the main result of stress is burnout. And one of the most common is depression, insomnia, anxiety disorder, eating disorder, and even hypertension. So stress represents an evolutionary life-protecting principle of regulation to threatening situations with a suitable concept of fast reactions for vital maintenance. So according to WHO last 2010, depression is a quiet epidemic. So it's #1 worldwide within 20 years. So with burnout is around 25 to 45% of the mental diseases, or 1/3 of the population experiencing burnout. With depression naman, it's around 10 to 18% for the medium to severe depression. And for the minor depression, it's around 5 to 7%. So these epidemiology is based on the European epidemiology, specifically Germany. So we can see here that women are more prone to experience burnout, depression, and anxiety, and also some physical diseases like dementia and stroke. It's how they handle stress. And what is the cause of stress? Actually, it's really costly because it affects how we work and how we contribute to the economy. So around 29 billion euros are lost per year based on the computation in the epidemiology of German journals. So there's an 15% increase in the prescription of antidepressants per year. And indirect costs would be absenteeism, presenteeism, which is cost very high, and most frequent early retirement. So there's also loss of life quality, like there's a feeling of job uncertainty, and there's an increase of complaint, burnout, and sleeping disorder, which is usually common for CEO and manager. So what are the psychosocial stress factors? There are negative life events in general and professional that's causing the stress. The most common cause for the negative life events are death of a close human, conflict in partnership like divorce or annulment, abuse or neglection as a child, and emotional conflict, and even strong events like surgery, accident, and even theft. So for general, noise can actually cause stress. It can cause restriction in sleep and also anxiety. In profession, what are the things that causes stress in our profession? It's lack and pressure of time, lack of design option, and lack of interest, high responsibility, shift work, which is those people who work at night, and continuous concentration during work, also techno stress and poverty. So what are the important life events which will actually trigger the change in our hormones and the way we respond to stress? So these are the important life events, intrauterine, meaning inside the womb. So if you're a mom and you have a baby, if you're experiencing problems, the baby can feel it. Actually, there's a trauma already to the baby. And also postnatal, after giving birth and during childhood, adolescence, fertile phase, premenstrual, postpartum, and postmenopausal. These are the vulnerable life phases for negative life events. For kids, usually the diagnosis in children, usually the symptoms that we can see is anxiety, headache, loss of concentration, and sleeping problems. Stress in early childhood and depression in women are very common. So here, we were studying about the correlation about the hormones and the degree of stress being experienced by a child and by a woman. So what are the various trauma that can affect stress and that can trigger burnout or depression? This is, of course, the war, prison, torture, and violence. And also poverty is a great contributor for stress. And this is how they evaluate poverty in European countries. So no heating in an apartment, living in an average size apartment, and there's an ability for repayment of rent, and you cannot invite friends to own home. And of course, we have a different way of describing poverty here in the Philippines. So it's two different things. So poor people are twice-fold sick. Poverty and disease are closely related, like Siamese twins, and separation was not possible until today. Also, right now, it's not only money which might cause stress. It's also the time, and there's a phrase that not the time is running, we are running, because of the internet and the globalized stack. Sometimes there's a dissolution of time as a cultural good. So the key factor is being mindful for your own demands, because at times you really don't think about yourself. It's just that you think of what needs to be done for the day. So that's time consuming. And also, we should be mindful that noise can affect stress. According to study, every year, there's 2,831 people who die by myocardial infarction or heart attack due to traffic noise. So noise more than 50 decibel increase the cortisol, which is a hormone for stress and blood pressure. Other noise of stress would be streets, disco, and computer games, and even iPad. And with work, there's a study that men with severe professional load have double the risks for stress. And there's numerous studies focus on health risks such as hypertension, heart disease, and depression due to chronic stress. So here we can see there's the effect of stress in the workplace. If there's a higher requirement for tasks and obligation, and there's a low reward, or meaning there's a low gratification, that can contribute to the stress of a person. So what are the symptoms of stress? You can feel back pain, hypertension, metabolic syndrome. If you have high abdominal circumference, that would mean you're unhealthy. That's one of the key factors that can tell you that you're unhealthy. And one of the main cause of that is stress. And also stress can actually activate man-made diseases like diabetes and atherosclerosis and heart disease. And for the psychological disease, burnout, depression, anxiety, sleeping disorder, eating disorder, and addiction. For the neurobiology of stress, so this is a study that discusses the effect of stress and performance at work. So here, if you see if there's a low, on the left side, if you have low arousal or low performance, meaning you have a low stress level. So, but if you reach the midpoint, there's a intermediate increase in stress and in arousal, which means you were able to reach the highest level of your performance, which is good. But if you go further, if you have more stress or arousal, it will actually inhibit inhibit the release of the optimum release of your optimum performance. So I think based on this study, better to have an intermediate stress or arousal. It will give you the best performance that you can give for your work and for your personal living. So here we can see the effect of our activity that on each brain parts. So here are the hotspots of stress. So I'm not going to go into details. I just want to enumerate or let you know that it's really related. I mean, everything is related to the brain. The release of the hormones are being released in the brain based on how we respond to stress. So here you can see that even as a child, there's a release in the stressors in the brain. If a child experiences a certain threat while in the womb, or if a child is experiencing abuse, verbal abuse, or even physical abuse, it can contribute to the malformation of the brain. So there's a study already that actually proved the effect of those negative life events to children, especially for children between 3 years old to 11 years old. So what are the predisposing factors for stress-related health problems? Of course, some people, they're more prone to have depression because they have the gene for it. Others, it's because of the life phases, like what I mentioned earlier. What are the life events which are very important milestone for us to have a peaceful environment, because that will contribute to the formation of psychosocial diseases, and also the negative substances that can cause or can trigger stress in our body, like alcohol, too much alcohol, drugs, and even medications and virus infection and inflammation, and environmental toxins. So even with the food that you eat, if you eat too much fish, actually will cause accumulation of toxin. That's why it's nice if you can control also with your diet what are the causes of environmental toxins and how can you eliminate it. So here we can see the type of stress and also the hormones that are being changed with the way how we adapt to stress. And also here we can see the genes that are responsible for the activation of burnout, stress, and even anxiety. So there's a genetic predisposition talaga for stress. And here we can see that even the epigenetic or the genes and the environmental factors affect on how we develop or the way we respond to stress. Like here, there's a study that if a mother rat takes care of her child, there's improvement with the development of hormones, good hormones, which can lessen the chances of anxiety behavior formation in the offspring. And here, these are just the hormones that we evaluate whenever the patient asks for tests, if we can evaluate, if we can differentiate if there's a burnout or stress or anxiety or any kind of psychological disease that we might need to evaluate. So this is more for diagnostic. So we need normal balance between excitatory neurotransmitter and inhibitory neurotransmitter. So this is for the flight and fight response of each patient. So here we can see that the number of negative life events actually contribute to the activation of certain psychiatric diseases. So the first negative life event might not cause any anxiety formation or burnout, but as you increase the negative life event, it will actually cause the activation of the psychiatric diseases, or if you don't develop psychiatric diseases, the somatoform diseases that you feel in your body, like back pain or hypertension or high blood or stroke. And the fourth hit, here in the fourth negative life event, you can even develop neurodegenerative diseases or like activation of the Alzheimer's or dementia. So these are the parts in the brain that is responsible for the formation of these hormones that regulate stress. So actually, when we're stressed, when you go to the jungle or to the forest, when animals are stressed, they have this fight or flight response. Like if a deer is being chased by a tiger, and parang there's a high in the fight or flight response. But once the deer was able to escape the tiger or the predator, there's he can actually switch it off, the fight or flight. But for humans, our tendency kasi is we cannot able to switch off that stress. So sometimes even if there's no stress anymore, the stress the stress in us is still activated. So we're still in the fight or flight mode. So it's really very tasking, and at the same time very, very tiring to have that stress in our lives. So we're not like animals where we can able to turn off that stress level. So if you push too much, like if you have too much of that stress level, it will actually lessen your energy in the way you respond to stress. So it's very important on how you deal with these stressors. So there are different response of people to stressors. Some people, they were able to adapt, and you can see that on their hormones response. Some people, however, there's a maladaptation. So they cannot adapt to the stress. So that's why you can see the diseases, somatoform diseases, and the psychological diseases being manifested already. So for the consequence, actually, the effect of stress, the difference of depression, anxiety, and burnout are actually based on the hormones. You will actually see it when we try to evaluate the level of hormones, neurohormones from the brain, and also how the patient answers the questionnaire to differentiate certain certain causes like depression and burnout. And what we do, we actually examine the hormones. We get the hormones by getting the cortisol and or also the serotonin, the GABA, everything by getting some of the blood tests and the saliva tests. And then after that, we ask the patient to fill up certain questionnaires. And then we give patients some heart rate variability measurement for 3 days, which can actually measure the brain activity. And from there, we correlate the brain activity, the heart rate variability, and the hormones, and also the questionnaire to detect and to diagnose if the patient is experiencing burnout, depression, or anxiety, or other things. So here, what are the things that we can do? Like if you feel there's a symptom of already na you feel tired, or some of the somatoform symptom you are already experiencing, better if you can try now with the treatment or some of the things that you can do at home. So one of those things is mindfulness. So mindfulness is being aware of everything, and then at the same time practicing self-awareness and self-love. Coaching, however, is different. This is a specialist or a life coach talking to you and analyzing what are the things that we can do to help you regroup, to help you be the optimum, the best version of you. So actually, when you talk to friends and to other family, it will not actually heal you. Sometimes you need someone who is a specialist just to guide you on how you heal yourself. And of course, you need micro pauses. Micro pauses is that you do like 3 to 4 times a day. You just pause for 3 minutes and just be aware of your breathing. It will actually calm your vagus nerve, which is really helpful to heal your body. Kasi it's really true that brain is very important factor to control your health. So if you will it, you can be healed. But of course, you should be mindful of that. So here, these are the different hormones that we test when we do diagnostics to treat burnout. And one of the things that we develop when we are confronted with stress is resilience. Resilience refers to a positive adjustment process in the context of adversity, trauma, tragedies, threats, or significant sources of stress, such as family and relationship problems, health problems at work, and financial burdens. It means to get back on track from difficult experiences and situations. So these are actually the measurement of the hormones. When you see if there's a maladaptation to stress, and adaptation to stress. We usually do this once a year to managers and CEO, just to make sure that they're getting their best performance, which will be good for the company. So which symptoms are associated with stress? When you have a feeling of, when you have sleeping problem, lack of energy, fatigue, tiredness, muscle tension, headache, digestion problem, loss of libido, respiratory problem, anxiety, depression, palpitations, and of course, negative life events like trauma. So this is what we do in the clinic. We do integral stress tests. Like what I mentioned earlier, we give questionnaires, we measure the hormones, and we measure the brain activity by giving the patient a heart rate variability for 3 days. And then after that, we also measure the BMI and also some of the hormones. For the treatment, it's a holistic stress coping oriented on regeneration, restitution, and resources. We do life coaching, that's very important, or psychotherapy. But we also tell the patient to practice mindfulness every day. So being conscious here and now without evaluation. So that's why better if you don't know how to meditate, you can download apps like Breathe, BREETHE. Just do simple meditation for 5 minutes every day. Even if you're up already, if you're driving, just do that. It will actually improve your mindset. Actually, there's a study that meditation or mindfulness will actually lessen the chances of degradation of your telomeres, which is in your chromosome. So it's for longevity kasi. So it's good. Mindfulness or meditation will actually improve your longevity based on studies. So it's really good. And prayer is a form of meditation. Also doing micro pauses for at least 3 minutes every day, several times a day, because it will stimulate the vagus nerve, which will affect on how we form or respond to stress with our hormones. Also relaxation technique, if you can do yoga and self-training, like doing Qigong or Tai Chi or transcendental meditation, mindfulness exercise. And if you can do low demanding aerobic exercise, like walking at least 5 to 6 kilometers per day, which will actually decrease the visceral fat. That's based on study already. We also give neuromodulators like rhodiola to patients depending on the level of their hormones, because we believe that if we can give the patient adaptogens instead of psychiatric medication, the patient might be able to improve more, because we want the patient to participate with his or her healing by being mindful of what needs to be done. Kasi it's not only medicine, you really need to be mindful of your lifestyle, which is the main reason of the cause of inflammation in the body. So self-development, strategizing for oneself. And there's 3 M's for stress reduction. This is music, and then meditation, and also massage. Massage will actually help, the touch actually helps with lessening of the cortisol. So I think even with all the massage there that is available nowadays, nothing can replace massage because of the touch, the healing power of massage. So those 3, meditation, music, and then massage. Also, if you can practice the autogenous training like Tai Chi and Qigong and yoga, that would help with the healing. So these are some of the practices that can actually help with the healing of oneself. So meditation is different from relaxation. And also transferring your main activities in the morning and low demand activities at night. And it really helps if you do siesta or nap in the afternoon because there's a recovery in the brain. The best is at least 1.5 hours because you complete the cycle of sleeping, which there's a certain improvement with the how your brain respond to certain work. And of course, the effect of TV, PC, and smartphone really causes stress in our body. So those are the things that we can do while we evaluate ourselves. So thank you so much. In the clinic, we have been seeing patients for actually burnout and even depression. So we have life coaches in the clinic that talk to our patients, and we strategize on how to treat these patients. I was able to. I personally experienced burnout 4 years ago. So it was when I was pregnant. At the same time, I was also studying and doing clinics. So it doesn't mean that even if I'm a doctor and I know what to do, it doesn't mean that you can be treated. It should be active. You should know how to. You should be active in doing what's good for yourself. I mean, be participative. Participate with the self-healing. You cannot just take medicine for this one. It's also lifestyle, which can contribute to our healing. Do you have any questions?
Thanks. Thank you, sir. Thank you,
Yeah.
Dr. Casey, for that. Let's just go to some questions now. I think before we continue, maybe let's give away a prize. What do
Yes,
you
yes.
think?
Yes,
Shall we do
please.
that? Okay. Let me just see. We are gonna give away 3 sets right now. We're gonna give away the first prize, which is 3 sets of called A Gift of Beauty at Home. It's a total glow body scrub and peel worth 4,800 pesos per kit. This is the ultimate all over skin makeover, and Total Glow is Luminisce medical grade body scrub and peel kit that combines 5 skin rejuvenating technologies in just 3 steps. Doctor, you want to talk about this total medical grade body scrub? Just give us a
Mm.
little bit of an intro.
Actually, with this one, we believe in the total holistic way of treating the patient. So sometimes, even if you have a good lifestyle, like you run and then you eat healthily, that's 60%. It's good if you have good genes and you have a good lifestyle. That's 60% of the aging process. But the 40% is intrinsic aging. That even if you have good lifestyle and good genes, the body will age. So that's why we have something like this to exfoliate the skin, which will contribute to the exfoliation and then rejuvenation of the skin, because there's also a study that was released in Japanese journal that looking healthy and looking young will means that you will live longer. So that's been proven already now, Japanese journal. So for us, we believe that when you treat a person, it's just not just inside, it's also the external part. So we have this medical grade peel, which is medical grade, meaning around more than 20%, more than 10% alpha hydroxy acid peel or plant acid peel that will remove the dead skin cells in the body, and that actually it will absorb water, so it will hydrate your body. So it's really good.
Okay. Okay, with that, I'm sure you're all excited to at least get your hands on one of these sets. Just a little background on how we pick the winners. We put all the names of all the attendees on in a pot and just pick them out blind. So for this special giveaway worth 4,800, we have Virginia Cheng. We'll get one. Ria Tanyada will get another one. And the third winner of this special giveaway is Lana Johnson. Congratulations, everyone. We'll be in touch with you to deliver your kits. Okay, we have a couple of questions here. We have a very good question here, actually. Um, you already know what to do, but are not motivated to start. How do I start to apply changes or simple healing by myself? This is an excellent question because, like you said, we listen to all these talks. We say, oh, that makes so much sense. Yes, I should do that. But the actual, from theory to practice
Yeah.
is something else completely. So, how do we motivate ourselves to get really into it? Especially now when our movements are a little bit curtailed by the pandemic.
Yes, actually, it's just so hard to motivate oneself. So sometimes you just need to feel the pain, or you just need to go through it, and then just give it a few days. Or, but if it's affecting your daily quality of life, it means you need help already. Sometimes you cannot do it by yourself. If Kasi minsan really if you just expose yourself to the sun, get the vitamin D, sleep and eat healthily and talk to a friend, you're okay already. But some people they could not find a way on how to heal. And with that, I think the first step is acknowledging that there's a problem, and reach out to someone, to a specialist or to an expert on how to treat it. Because sometimes if you just Google it or talk to a friend, it doesn't mean that it might help you, especially if you practice this mindfulness technique. Uh, but at some point, it's how you respond to stress. So if you were able to give yourself a few days or 2 weeks or 3 months to be able to feel the pain or the stressors that's affecting your body, I think it's time to approach someone, just to make sure lang na it will not actually affect your profession and the way you treat your family. So that's why we give patients some advice, especially life coaching. That's very important, because what we realize is just, even if you're talking to your friends or to your parents or to your loved ones, it will actually not contribute to healing. If you have certain anxiety or burnout, it might not be the best thing to do. You might need further help from an individual. So if it affects your daily quality of life, please ask help already.
Dr. Casey, can I just ask you also? Luminisce is, I mean, a skincare clinic, skin renewal clinic, and all that. Even if your approach is holistic, how do you correlate? I mean, in a way, it's a little bit top not, I wouldn't say superficial, but you're dealing with the skin and all that. How does that translate into a kind of inner body
Yes.
wellness?
Mm.
Um,
Because most of the time, the inflammation, you see it on the skin. Actually, it's just not a skin problem. All the skin concerns that you see on the skin, you get it from the inflammation that you feel inside. And the inflammation is not just because of certain diseases. It's also the negative, the inflammation or the toxins that you get from the environment. So that's why when we see a patient, I most patients, they go to the clinic not really for this, but when we evaluate them,
Mhm.
I think we need to evaluate the way the micronutrients, because sometimes it's, you cannot just, if you have too much energy being sucked by your work or your or problems within the family, it will the it you cannot just get that from the food that you're eating. So there might be a micronutrient deficiency, and of course if they're aging, there might be a hormonal imbalance. And then also the food that you eat, the things that we can control, like the food that we eat or diet or nutrition, those are the things where we get the toxin that we need to eliminate. So for the skin, it cannot just be external kasi beauty is part of beauty, not only skin, is part of how you interpret if the patient is experiencing a healthy living. I mean, it's a key factor na parang it tells you if the patient is happy or not by the way you see the skin and everything, if there's too much inflammation. And then nagulat nga po ako with like when I saw the study from the Japanese journal, that being looking good or looking means that you're healthy. So that's why parang when we see patients in the clinic, even if it's just for aesthetic, um, aesthetic is parang ano na po siya, beauty, which can be equated to fashion, but it will not really go away because sometimes when you see beauty, people, they go to the clinic because they want to take care of themselves, to be aware, to do self-care, which is the first step if you want to treat burnout or any depression. Doing something for yourself. And sometimes you cannot just do that and do meditation. Sometimes you just want to lie down and feel good. So that's really correlated. But some people kasi they think that beauty is not just what's inside, but really skin is what you see inside. The inflammation that you've experienced, like from being exposed to toxin, like for example to molds, or even to toxins or metals that you get from like from the dental clinic and even from the food that you eat. So what we're trying to do is just to lessen the things that we can control.
What about for men? Because women, it's almost second nature, right? Oh, I want to book a facial, or like I said, aesthetic, caring for ourselves on an aesthetic level. We think, we need to do these things just also to feel good and to look good. How do you convince men to come in and also have the same kind of treatments, which could also lead to discovering inflammations, like you said, and other underlying causes for, for
Uh,
their state of health?
for the patients that we get from in the clinic, usually men who have a active lifestyle, who are athlete, or who are always exposed to the sun, or we have a high level of a high level of recognition in their work. They tend to go to the clinic to seek for something that will make them better. And sometimes from that, we of course we start first with the patient concern. And then if the patient is comfortable already and if he needs, and then if he's willing, I ask them if we can do some certain tests. Usually
Mhm.
for aging men, we do testosterone and other hormones to test the hormones, because there's so many men right now we have low testosterone level. And according to study, if you actually improve the testosterone level in hypogonadal man or men who have low testosterone, it's a prevention to have diabetes, dementia, Alzheimer, and even heart disease, and even cancer, certain cancers. So also we also look at the micronutrient level. But of course, we start first with our main concern, the skin. But some men who go to the clinic, they just go to the clinic because of the women, the wife. And we just start with the proper skincare by telling them to apply sunblock, especially if they have an active lifestyle, which is number one cause of aging is the sun, photo aging. 30% of aging is from the sun. We just tell them to make sure that they apply sunblock and then low dose retinol for healing if they're not going to be exposed to the sun, and something, a moisturizer with peptides and ceramides that will help heal and the skin and rejuvenate the skin, and vitamin C and other vitamins that can help with the anti-aging for the skin. So we start with that first. And if the men are comfortable already, and then if they have concerns, then we go further. Actually, we have men who are doing testosterone therapy and other hormone therapy in the clinic already. But the problem with us po kasi, since we're known as a laser and aesthetic clinic, hindi siya nako-correlate into preventive medicine.
But do you find any kind of similarity between men and women? I mean, any kind of level of resistance to, you say, like going beyond the aesthetic, like for life coaching and all that? Is there still a little bit of resistance, more
Uh,
for men or women, or the same?
uh, for men who need for men who go to the clinic and we think that they need it, no resistance at all, as in go. Mas yes pa sila than women. But some men kasi are doing well. They don't have low hormones, or they don't have imbalance with their hormones and with everything, so it's harder. So we don't really push them to do this
Mm.
stuff, because the diagnostic test is actually costly din po eh. So that's why we only promote that to patients who need it.
So at what stage do you do the diagnostic test?
When I see that there's at this time of our lives, 6 months after the pandemic, I mean, there's an activation of uh like lupus and
Mm.
cancer. So right now, I see so many patients who I encourage to do life coaching and to do some tests. So right now, there's
Mhm.
actually a surge of people who's doing this treatment already because of the pandemic, the heightened stress of the pandemic.
Yeah. Are you able to do face-to-face consultations now, or are they still virtual? But the treatments would have to be face-to-face, right?
For aesthetic, yes, face to face. Yes, we do face to face consultation, because most patients they prefer face to face.
Mhm.
But for this, the integral stress test, we can do that online, because we
Okay.
have some life coaches from Germany, not only from the Philippines. So we usually do it online also.
And can I just ask a question about with the life coaches from Germany? Is there any kind of cultural um, adaptation that they have to do to understand, let's say a patient like me from the Philippines, there are certain specific factors that are
Mhm.
unique maybe to our situation in the Philippines. Would a life coach in Germany necessarily understand that? Or is it
Actually,
just
there are life coaches na it's a science. Life coaching is a science. So it's more of a, it's like diagnosing, you're like a doctor. So
Mhm.
there's no cultural difference actually.
Okay,
But of
okay.
course, the like for something for some of my patient, they need to explain pa to the German like the impact of this. Like right now, some of them they don't want to have to get the Filipino life coaches, because they don't want it. They Because these are celebrities or some personalities, so they just get the
They
German
want the
one,
confidentiality.
which is I think okay naman, because it's just
Yeah.
like talking to a certain person, or a specialist or an expert who's going to help you. It's the same, no cultural differences when it comes to life coaching.
Okay. Okay. Now we have more specific questions here. Would you recommend collagen supplements to improve the appearance of skin? And would it be powder or tablet or what form?
With the collagen, our body is made up of different types of collagen, especially collagen 1, 3, and 5. Uh, in rehab medicine, for people who are experiencing joint problem, it's really good that you take collagen. But according to studies, if you're going to review the studies, journals, medical journals, there's no study that actually tells you that there's a significant impact of collagen powder and collagen drink on the skin quality. But if you're going to take collagen, why not? If you have the extra money, why not? I would have, now I'm taking collagen. If you're going to take
In
that, at
what
least
form?
10
In what form are you taking it?
oral.
Or oh, okay. Available at your clinic?
Yes, yes. It
Okay.
depends on the formulation po kasi. Like maganda sana if the brand will present you some studies that it's effective, because sometimes there are formulations that there's no study, that's why it's less expensive, but you don't know if it really works.
Mm-hmm.
Uh but if you're going to take collagen, at least 10 grams would be nice per
10
day.
grams, okay,
Mhm.
per day. Okay, maybe let's go to the next round of the giveaways. We have 5 sets of luxury facials worth 3,000 pesos each. And these are available to claim at Luminisce, right? At the clinic. So this facial relies on several skincare advancements like the process sonophoresis, where skin nourishing vitamins are delivered and absorbed by the skin through ultrasound waves, and oxygenation, which releases cool pressurized oxygen to hydrate the pores. The treatment also begins with a facial massage, adding to the luxurious experience. Dr. Casey, how long is this procedure usually, this facial?
Uh, in the clinic, we do it for 40 minutes to 1 hour. Here we use medical grade products, but we make it we make the like portable devices available. But in the clinic, we use medical grade devices. If you're going to do that at home while watching Netflix, you can just do that for 20 minutes.
Oh, okay. Okay. So if you come to the clinic, you'll be guaranteed a very luxurious pampering session, right? We have 5 sets to give away, and the winners for today are Arlene Ke, Cheryl Gregory, Nenny Santa Romana Cruz, Jill Santos, and Maria Jessica Banal Russell. So that's Arlene Ke, Cheryl Gregory, Nenny Santa Romana Cruz, Jill Santos, and Maria Jessica Banal Russell. Congratulations to our winners. We'll be in touch with you with instructions on how to claim your prizes. Okay, let's go to another question. Um, someone's asking, can you give guidance on how we may approach you if we want a service that caters not just to the skin, but to reduce stress or burnout?
You can just message Luminisce via Instagram or Facebook or our hotline or our website. I mean, we're open for online consultation, especially if you have specific symptoms.
So when they make an appointment, is there like a questionnaire that they fill out so you can kind of identify what they might need?
Some people, Miss Perbina, they parang they don't want parang questionnaires na. Ayaw nila masyado maraming finifill upan.
Yeah,
So we just go straight and do the online consultation.
yeah. And would the online consultation be free?
For friends and yeah, for friends and family. And yes, for some people, yes. Because
And
sometimes,
Vanilla House
to
members?
be honest, if you're going to do skin consult, probably it can take around 5 minutes to 1 hour. But if you're
Mm,
going to do preventive medicine consult, it will take about 1 to 2 hours. So it's not really just oh, look at my skin. What do you think? It's not like that.
yeah.
Preventive medicine is different. You have to
Mhm.
evaluate everything.
Okay, great. Thanks. There's a number here in the chat for Luminis patient care. The mobile number is 0977-804-4601. And innocence.ph. Oh, there. It's on the screen right now if you want to reach them. I will go now to the next prize. It's one set, the gift of relaxation for its True Detox face and body lymphatic therapy worth 20,000 pesos. True Detox lymphatic drainage is a deep tissue massage that uses a technique unique to Luminisce. Sorry. True Detox helps retrain facial muscles and posture by enhancing blood flow in the area and jump-starting the production of collagen and elastin. All of these working together help to lift and sculpt the face while you simultaneously enjoy deep relaxation. So this is a giveaway worth 20,000 pesos. And Doc Casey, what makes lymphatic therapy different from normal massage? From,
Mm,
let's say, massage or, the
one,
normal
it's
everyday kind of.
stimulating. The lymphatic massage actually uses um, some specific stones, the guasha stones. At the same time, we do it by following the lymphatic system, by draining the lymphatic system, because most of the toxin they're being drained in this kind of system. So these are the toxins. So it's really good if you want to lessen the toxicity in the body, because it's different from the ordinary massage, like when you just do the muscle, just to lessening the muscle tension by just touching the muscles and then the skin. This is different type of parang it's the different uh different way of treating the body. It's not, it's just following the lymphatic system actually. And then certain points.
Mhm. Okay, and today's winner is Ace Gapos. Congratulations, Ace. Again, we'll be in touch with you on how to claim your prize. So that is a gift of relaxation, a true detox face and body lymphatic therapy worth 20,000 pesos. Thank you, Dr. Casey, for being so generous with your giveaways today. I just want to go back to the questions. You mentioned earlier about fish, maybe eating too much fish. You know, you might be ingesting a lot of toxins, but then you're also told to veer away from meat. So, how do you find the right balance in the, because nutrition is a very important part of wellness.
Yes. There's a study, if you want to repair your telomeres, which is part of your chromosome, for longevity and for proper aging, is you do Mediterranean diet, and then even meditation that will actually heal the body. So, and then improve longevity. So what is Mediterranean diet? It's more of a plant-based, and then it's more of antioxidant based diet. So with the food, it's if you're going to eat meat, I don't really recommend vegan or vegetarian. But if you want a more healthy lifestyle, it's more of plant-based diet. So more of plants. But if you're going to eat meat, we suggest that you eat white meat at night. You can eat the hard meat like steak at lunch, because at night you really don't digest it very well already, the food. That's why we don't recommend raw vegetables and red meat at night unless you have a
Mm,
celebration.
yeah.
So
Is there a specific time that you recommend to stop eating for maximum more the most beneficial kind of digestion, maybe?
there's a study that dinner canceling is really good for the body. It actually helps with the reset of the mitochondria, which is the powerhouse of the cell of the body. Dinner canceling would be nice, but like for me, I cannot really do dinner canceling because it's a form of socialization with family.
Mm-hmm.
So what I do, I just eat fruits, or I try to eat white meat when I'm in a celebratory mood, or something with like soup, or
Hmm.
with my family. So
Yeah.
it's that some people who do dinner canceling, they actually experience the benefit of that in their system, because there's increase in the metabolism by doing
Mhm.
the proper time of eating. But if you cannot, if you want to eat at night, if you really want to eat at night, because when you're stressed you crave for sugar, just go
Mhm.
for fruits.
Okay. Now, you mentioned sugar. What is the best way to cope with sugar? Like trying to avoid it to help you not think about it so much and
Mm. Sugar is like very addictive, because when we're stressed we really look for sugar.
Mhm.
But one of the main cause of inflammation in the body is consumption of too much sugar or too much carbohydrate, especially the processed one. It's actually accelerates aging of the skin, and then it causes glycation. That's a process of free radical formation or inflammation in the body. So
Mhm.
with people who have acne or who have too much inflammation, we recommend a low glycemic diet, or low low calorie diet, just to lessen the inflammation.
Mhm.
um it's really up to the mind, because it's hard.
Yeah.
Like for me, it doesn't mean that I don't eat carbohydrates, especially I have a 1-year old and 3-year old.
Mhm.
Mm.
I know that's the hardest, right? I think sugar is the most addictive drug there
Yeah.
is, right? More than anything else. Okay, let's go to the last. We're running out of time. Let's go to the last prize, which is one set, a gift of wellness, which is an immunity boosting drip for two people. So you and your partner, worth 24,000 pesos. So when you feel like your immune system needs a significant boost, this drip with a clinically safe high dose of vitamin C will give you what you need. So this one you have to do in the clinic as well, right, Doc Casey?
Yes, but we also offer house call or home service.
Okay, okay. Well, there you go. So if you don't want to go to the clinic, they'll come to you. And our winner for today is Mark Wang. Congratulations, Mark. We'll be in touch with you to claim your prize. And so that is all we have for today. I just want to remind all Manila House members that Luminisce will be giving a 20% discount to all members of Manila House Private Club for facials and laser treatments and procedures for the next 6 months, starting from September 22 today. Just present your membership card when you go to Luminisce. And again, you'll see, can we flash the details of Luminisce again? For people who may want to get in touch with them for an appointment. There you go. Cell phone, phone number, and email address, and website. I see someone with a raised hand there. Catherine Marioles, do you have a question, or were you just raising your hand? I just wanted to make sure. Catherine? Okay, maybe she was just saying hello. And okay, Doc Casey, any last words? Can you like kind of summarize everything you've said in like what would you say would be the best approach to avoid burnout?
Um,
In quick
the best
notes.
approach, yeah, the best approach to avoid burnout is to control the things that we can control, like lessening the inflammation. Like for example, with the nutrition, if you can just steer away from processed food, and yes, if you can just do it more plant based, that would be better for us. And then if for the other toxins like we get from if you can ask or if you can have someone clean the house for the molds and exposure to mercury and other toxins like with the food and with the environment. And then of course, if you can do exercise, it will actually help. The best exercise is to do resistance training, which is muscle development, which is not really muscle building. It's different because if you especially if you're aging, the hormones are dwindling or going down. So if you improve your muscles, it will actually improve your hormones. And then if you can also do cardio around 6 kilometers per day walk, it will remove or it will actually cause a decrease in the visceral fat or the fat surrounding your organs. So that's really good. So if you can do that at least 3 to 4 times a week, that would be nice. And of course, in the morning, if you can have time, like to pray or meditate, it has a healing power to your chromosomes, to your genes, which can improve your longevity and your mindfulness. Because sometimes when we attack the day, like with our work, we should have at least 5 to 10 minutes for ourselves just to calm everything, just to calm the mind. And then um, if you can also do incorporate in your lifestyle, if you have like a hobby, if you can have a hobby that will actually help with the mindfulness technique like yoga, meditation, and then music, choosing the right music, and then doing massage, that will also help. And being mindful or self-aware what's happening. I mean, as we age naman kasi we really don't care. We lessen we really don't care too much now what other people think, which is really good for us because actually it's very stressful if you just believe what every people tell you. So you should be
Mhm.
aware that in order to give the best of yourself to your family and friends is to of course, protect and heal yourself first. I mean, treating yourself as a friend and as a loved one. You should be your number one supporter. And if you
Oh,
cannot do that, best is to ask for an expert to help you because sometimes it cannot be done alone.
that's amazing advice. Thank you. That's really great advice. Just wanted to clarify one thing. When you said resistance training in exercise, could that also be like Pilates or, the gentler type, or
It's
it doesn't have to be with weights?
yeah,
How do you get resistance ones?
you can do circuit training and then weights. With Pilates, it's more flexibility. It's different from resistance training.
So, but even if you change the you have resistance bands and everything in a Pilates.
Yeah,
But
that would be nice. Yes. If the
but
circuit training, yeah, is also
yeah,
included in Pilates, that would be nice for the
yeah.
resistance training.
Okay. All right. Okay. On that note, I'd like to thank Dr. Kaycee Reyes for joining us today for a very informative discussion on burnout, what leads to it, how to detect it, and what you can do to actually counter it and live. Maybe I think we can't avoid stress in our daily lives, but we can certainly minimize it and sleep better and have better relationships as well. And also it comes with a lot of more self-acceptance, and when we're happy with the way we are, it will also reflect in our general health and well-being. Am I right, doctor?
Yes, I agree, Miss Alina. Thank you so much.
Okay. Thank you so much for joining us. This webinar will be up on YouTube in a day or so. And well, there's someone who sent some parting words here, and I'll repeat that. Be healthy, everyone, and stay safe. Thank you, and see you again soon.
Bye bye.
Bye.